Today, smokers across the country will try to quit tobacco. The American Cancer Society is marking the 37th Great American Smokeout. It's a day where smokers everywhere are encouraged to kick the habit. Almost 1 in 5 adults in the U.S. are still hooked. Smoking is still the largest preventable cause of disease and premature death in the country. Now, joining us is Dr. Jonathan Whiteson, Director of the Cardiac and Pulmonary Wellness Program at NYU's Langone Medical Center. Dr. Whiteson, good morning.
Good morning. How are you?
Now, what is the medical consensus about how to quit smoking?
Well, we understand that smoking is a very complex issue, and not only is there a chemical dependence on nicotine, but there's also a behavioral and emotional dependence on the actual act of smoking. People smoke for pleasure, people smoke because they're anxious or because they have stresses in their life. So we need a program that really addresses all of those issues, the nicotine addiction, as well as the behavioral and the emotional behaviors that go along with smoking. So a comprehensive program is what we look for.
One of the things in the summer that I always see are those patches on people's shoulders.
Yes.
Do they work? What are the pros and cons?
Yes, the patches do work. Those are nicotine replacement patches, and for those people who we consider to be moderate or heavy smokers, they're very effective. And they come in different strengths. The strongest strength patch is for those people who are heavy smokers, at least a pack of cigarettes a day. And over the course of 4 weeks, the patient or the person, the smoker, will wear that patch on a daily basis and change it on a daily basis. And then hopefully the nicotine patch is providing them with the nicotine. They don't need to smoke to get their nicotine fix. They don't go into that withdrawal, which is so uncomfortable. So patches do work.
What about the gum? I see people chewing that gum and they're saying, oh, it gets the fix. Does it work?
It does work as well. Probably the best way to quit smoking with a nicotine replacement is to use the patch, but at the same time to use the gum or a lozenge when you're having a craving that the patch isn't satisfying. So in combination, the two together work very well. Now, some people don't like the patch. They feel uncomfortable with it, they get nauseous, or they have local irritation where they put the patch on, and they'll only use the gum. And so they'll chew a piece of gum whenever they feel a craving, and as that craving settles, they'll stop using that gum.
Now, I also hear about these pills. With chewing gum, the patch, are pills even more effective?
Well, the pills will work in a slightly different way. The pills are not nicotine pills. The pills that we refer to and prescribe are Wellbutrin or Chantix, and both of those pills will work centrally, so within the brain, and they'll work to reduce the cravings for nicotine as well as reduce the pleasure that people get from cigarettes. So if we can take away the pleasurable part of this, then people won't want to smoke as much.
Well, that's big. So the patches don't affect the pleasure. They just give you that sort of stimulation, right?
Exactly. The patches and the gum and the lozenge just give you the nicotine, but the centrally acting medications will take away the sort of the desire or the pleasure of smoking.
There's also a behavioral element to this. People like holding the cigarette, and I see those people with the e-cigarettes. Do they work, though?
Well, first of all, yes, this is a behavioral issue that we need to address, and we need to change people's behaviors, and we also need to identify people's triggers to start smoking or to pick up a cigarette, a cup of coffee, a walk down a certain path, a certain time of the day, and we need to address those issues to help people stop smoking. And the issue about e-cigarettes is they are not approved by the FDA, they have not been studied, and we really don't know how much nicotine is being delivered each time somebody takes a puff on an electronic cigarette. So from my perspective, they are not recommended for tobacco cessation or smoking cessation.
That's great advice, especially today when so many people are going to try to kick that habit. Thank you very much, Dr. Jonathan Whiteson, Director of the Cardiac and Pulmonary Wellness Program at NYU's Langone Medical Center. Thank you.
Thank you.